But we had to go to Hungary to tell it. In the 90s, a London vet discovered a cancer treatment whilst working on his dogs that could save lives. 10 years later, some human patients believe it has done just that.
Despite the successful trials, the strict rules that we have to adhere to here in Britain mean that the drug has had to go to Europe to be licensed. So, what could it all mean for the future of cancer care? Well, Liz Wickham has our special report.
It's not often a London story ends up in Budapest, but I've come here with Professor Andor Sebesteny, a Hungarian refugee who rose to prominence in London as the Home Office veterinary surgeon at Cancer Research UK. We worked together 8 years ago in Harrow, when Andor was supervising the work of an eccentric but brilliant London vet called John Carter. He was determined to find a cancer treatment not as damaging and dangerous as chemotherapy or radiotherapy. And after years of studying biochemistry, he invented CV247, a non-toxic compound he was trialling on dogs in his surgery.
4 ingredients it consisted of, and these ingredients were all known to have some anti-tumor effect, particularly as acting as antioxidants or parts of antioxidation system, which is well known to be a major factor in carcinogenesis. Most of them fairly soon after the commencement of the treatment improved in their well-being, and unpleasant symptoms disappeared. They became more active, more vigorous.
Since the end of communism, there's been an explosion in all things Western here in Hungary, not least the keeping of pets. And with the keeping of pets goes the need for new veterinary surgeries, and there's lots of them. Andor Sebesteny retired from Cancer Research UK and brought CV247 to Budapest to continue the trials on animals. He was met with enormous enthusiasm from vets and animal owners. Buck, the Alsatian, had a massive cancerous tumour on his leg and was facing amputation of the limb. But he's an old dog, and the owner decided to try CV247 instead.
We are very happy that this treatment gave the life to the dog.
How is
really.
he? How is
he is very good. Almost the same as he was before this tumor, yes. I think so.
But what about humans? John Carter had always been willing to give the compound to desperate people. Fred Porch had cancer of the kidney, which had spread to his lungs. Both Mount Vernon and Barts hospitals told him there was no hope. He had less than a year to live. He went to see John Carter and took CV247.
After 3 months I went back to the hospital, and John said to me, before you go, he said, "You'll be fine." He said, "Your tumours will have gone." So I went to the hospital and they did the x-ray and they'd gone, and they said it was natural regression.
He remains fit and well 10 years later. Formal clinical trials began at Addenbrooke's and the Bedford hospitals in 2001. They were successful through stages 1 and 2, but John Carter died last year and funds ran out to complete them. Even so, Dr. Ros Taylor prescribes it on a named patient basis to cancer patients at the St Francis Hospice in Berkhamsted.
CV247 is a gentle formulation that works in trying to manipulate the chemical environment of the cells, stop the cancer cells from spreading around the body and from growing. It's not toxic, and I'd like to see more investment in research and hopefully licensing. Yes.
The irony is that once CV247 completes trials, it won't be a hugely expensive drug that has to be okayed by NICE before you can use it. It'll be available over the counter with no prescription. And since my return from Hungary, it's gained its licence for use with animals there. Liz Wickham, London Tonight, Budapest.
Fascinating stuff there, and just to underline what Liz was saying there at the very end, CV247 has indeed now been granted a European licence for use on animals without prescription, but it may just be the first step to releasing it onto the human market, and we're going to keep an eye on that story and just see how it develops.
Now.